In celebration of International Women's Day, we at Famedix Pharmacy made the decision to join the International Diabetes Federation to celebrate women leaders in the community, as women leaders in society are often true catalysts of change. We are looking to recruit you as advocates in our local diabetes community, as voices of reason who can begin to change the narrative. We need to kill the phobia and let Nigerians know that it is possible to live healthy with diabetes. At Healthbeat Diabetes Care Center, we know that diabetes is hard, but we believe that getting help shouldn't be. As I often say to my friends and family living with diabetes who visit us at Famedix Pharmacy, living with diabetes is like taking on a second job, only that this diabetes career is a more important, more difficult job to juggle than the first at which you are being paid a salary. You all seated here can testify that diabetes is hard. Name it. Is it the cost of the medication? Is it the cost of medication? The fact that you have to use medicines twice or more a day, every day, every week, and every month of the year. Some of you who chose not to study nursing or medicine because of the phobia of blood and injections now have to inject yourselves with insulin daily. We know the battle we take to get some patients, and some of them refuse outright even when the doctors are prescribed insulin, they say they don't want to do injection. So, or is it the constant fluctuation of blood sugar levels, sometimes for no reason? Even when you are doing everything the healthcare professionals have asked you to do. Remember, the shock on your face when your doctor tells you that even the beans you now choose to eat 3 times a day is made up of over 50% carbohydrates. A lot of people say, why is my blood sugar high? After I've been eating beans, why is it still high? The beans we choose to eat is more than 50% carbohydrate. Since then, the fear of coming down with complications, that's another phobia. The fear of coming down with complications. Tingling and peppery sensation under the feet and arms. For men, erectile dysfunction. For the rest of us, taking care of the feet so that no injuries linger, which could lead to amputations if not well managed. The increased risks of coming down with a stroke if the individual also has high blood pressure. For some, fluctuations between diarrhea and constipation. We have patients who come in and say, today I have diarrhea, one needs to go, tomorrow I have constipation. We need to explain to them that it's all a consequence of this same diabetes, nerve damage, which can affect involuntary muscles like the long intestine and all. Since it is obvious that if you're a woman managing a full or part-time job, managing your husbands, managing your children, and also managing diabetes, you are nothing short of superheroes. You are nothing short of a superhero. It is no wonder the International Diabetes Federation chose to celebrate this year's International Women's Day with women leaders who live daily at the war front, winning the war against diabetes. Why do we need each and every one of us seated in this hall to pick up their armor and join the war against diabetes as advocates in our local communities? Because even though there is a lot of advancement in diabetes care and management, in sub-Saharan Africa, which we are in, we are fighting an uphill battle. One, over 50% of those with diabetes in our communities do not know they have diabetes. That is, over 1 in 2 people in our communities with diabetes do not even know they have it. We have had a practical case of a lady who went in and out of hospital admission for over a year. This is a true case, sometime last year. Over a year in and out of admission. She was as lean as a broom and was then prescribed a very rare multivitamin supplement to help her put on weight, because that was her only challenge. She wanted to put on weight. She was getting too skinny. She came to Famedix to ask for the supplement, and I asked her to sit down so we could check her blood sugar. We got a reading of 29 millimoles, and the rest is history. So it just tells you the challenge we have in our community. She had just come out of admission a month before she came to see us. Secondly, many of our diabetic patients still rely on a once every 2 months visit to a tertiary healthcare institution to see a doctor for the management of diabetes. Our primary healthcare institutions are ill-equipped to manage diabetic patients. Diabetes is an ailment that should be managed in the community. Ideally, only complications should be taken to teaching hospitals. But what we find, almost every patient we meet, do you have a doctor? Yes. How often do you see him or her? Every 2 months. We're teaching hospital. And I've often given the scenario of what happens when they go down once or 2 months. The doctors have no choice. A patient comes to the pharmacy a week before a doctor's appointment to buy 1 or 2 sachets of medication. You say, man, we haven't seen you for a long time. What is happening? You say, I have my appointment next week. So obviously the last 6 weeks, he or she hadn't been taking her medication. Then she wants to get a good result when the doctor sees her. So she gets to the hospital very early, 8 a.m. Most of them won't even eat lunch or dinner because they are afraid the doctor will tell them, oh, your reading is high. So you can imagine skipping lunch or dinner, getting to the hospital around 8, joining the queue to have your blood sugar test. So they get tested around 10 and they take a result in to see the doctor. The doctors depend on that result. So the doctor says, 5.2. Oh, you are doing very, very well. I think I need to reduce your medication. Because if your doctor has placed the patient on 2 tablets 3 times a day, and she's getting a result of 4.3 or 5.2, the doctor clinically will have to adjust. So the doctor reduces the dose, and the patient goes, finishes the 1 sachet she bought, and carries on with a blood sugar of 11, 12, 16, 20 something for the next 3 weeks. It is no wonder complications are very common within our community. Over 60% of our diabetic patients are first diagnosed. These are data we got from International Diabetes Federation website. In Africa, 60% of diabetic patients are first diagnosed after complications have set up. So they go to a hospital for an eye test, or they have challenge with the kidney, or they have a wound that hasn't healed, or they have an eye up. The doctor says, we can't do this eye up unless you do a blood sugar test. For many, it is at that point that they now find out the person is diabetic. I have a case in point. My dad had a stroke. He was on blood pressure medicines for many years in Port Harcourt. He went into a pharmacy. It's difficult to differentiate the quacks, and it's the same thing everywhere. Doctors, nurses, pharmacists, there are quacks everywhere. So let me say he went into a chemist, as we'll call the general, to check his blood pressure, and his blood pressure was maybe 110/72. And the nurse there said, low blood pressure is more dangerous than high blood pressure. You have to stop your medication. But the man happily, who wants to start continue taking medication, struggling financially and all, he stopped his medication. About 3-4 months later, he had a stroke. We moved into Asaba, and coincidentally, we put him in a private ward. I was doing my youth service then. I came to see him when I came to join them. It was the very first day I got there, I saw sugar ants all over the floor under the bed. It was coincidentally, I was the one that asked them, the nurse, have you people tested this man for diabetes? They said no. It was at that point. So obviously he had been diabetic for a long while, just like the statistics here show. He did not know it. He was hypertensive. Of course, diabetes and hypertension work hand in hand and led to a stroke. Thirdly, I was still on that number 3. Over 60% of diabetic patients are first diagnosed after complications are already set in. Note that all the complications of diabetes are preventable. Most, if not all, you can prevent. But once they have set in, they are not reversible and may be very expensive to treat. So some of them are not reversible. You may have to go to all the neuropathy and all those small ones, just manage them, But then imagine the patient who has had a kidney damage. So not only is it not reversible, the cost of treating it. That's why I had a patient yesterday say, you are shouting at me. She said she was going to give me her daughter. After she bought her medication, she was going to call her daughter so that I will thank her for sending her money. I said, Mommy, don't give me that phone. Because I'll first tell her that you are not The last she had to use her medication was 6 weeks ago before she came, because the reading of 16.9. As our first report to you, the doctor is planning a wedding soon, so she's very anxious that the mom will be healthy and well for the wedding at the end of the year. So our first report to you, we said, surprisingly, she didn't call the doctor again. She refused to give. She said, you cannot even keep a secret. I said, what kind of secret is that one? The long-term implication of what you are doing is not good, So continuing, I said the cost of properly managing diabetes is often beyond the reach of the average Nigerian. Therefore, creating awareness on prevention and getting people to test frequently so that they can catch it early is absolutely vital. We still have a problem in our communities where when you tell people to check their blood sugar when they come into the pharmacy, they say, diabetes, oh no, it's not my portion, it's not my family, it will never happen to me, and we just often smile when we hear that, and they refuse to check. So you can imagine why a lot of them are not caught early. We need a lot more voice to speak out and shout out for diabetic patients in our community. And hopefully, one of the reasons we're here, hopefully the government may begin to consider putting in place measures to support diabetic patients in our communities. Around the world, diabetes being a lifestyle ailment which you have to manage almost all your life, governments have formulated means of supporting. In Europe, for example, in UK, diabetic patients don't pay for medication. They are one of 2 or 3 medical conditions where they don't pay for it. No matter how expensive, they don't pay for their medication at all. In America, we know they have insurance and all that. But in Nigeria, nobody seems to care at all. So we need a lot more voices. So there exists in our society a morbid fear of diabetes because too many are ignorant and ill-informed. That is the only reason people, ignorant and ill-informed. I always give people one of the most popular diabetic patients we have in the nation, who is doing quite well. A lot of people have interviewed him several times, and he gives him advice: manage it, do all the right things, eat right, take your medication. Ex-President Obasanjo. I was asking them if we could use this TV, but they said it's connected to the main whatever. I was going to play us a little video of, I'm sure we've all seen it online, of Ushage playing football and dancing and all that. And if in his 80s, he's just an example to us that if well managed, you can live your life normally and well and healthily without having to worry. So in summary, this is why we need you. This is why we are gathered here. We need people to see that diabetes is not an ailment to be dreaded. We need our people to know that living healthy with diabetes is not only possible, but that there are women leaders in our community who are winning the battle against diabetes. So I say our open, honest discussions today, moderated by Dr. Mrs. Turea Amadu, a consultant obstetrician, for those who don't know her, gynecologist, will go a long way in helping us meet our objectives for today's International Women's Day celebration. So I'll be handing over to us soon. Thank you.